So I need your help. I'm coming to you today because I really, really need your help. In case you haven't noticed, and this is not a political statement by any stretch of the imagination, but healthcare in the US is jacked up. Like there's massive fight over, the ACA right now, Affordable Care Act, and everything else. And again, this is not a political statement, but here's the truth. We can't sit around and expect that government is going to solve this problem. What has happened is government has taken healthcare and taken care out of the hands of doctors and put it into big business. I don't really care what side of the political argument you're on. That's what they've all done. Okay? The only people profiting are the insurance companies. And it's time that we do something about fixing healthcare. It's time that we help doctors fix healthcare. And I know that might sound a little bit strange and whatever else, because we all grew up in this world where it's like, become a lawyer or become a doctor. Those were the professions that you wanted to get into because you'd be so well taken care of. Well, guess what? That's not true. I can't speak for the legal field, but I can tell you doctors are getting raked over the coals and raped daily. Last year alone, doctors received a memo from one of the major insurance providers that their reimbursement rate, in other words, how much they're getting paid for services that they do, was going to go down on average 9%. Now, I want you to stop and think for a moment. Were there any of your expenses that went down 9% over the last year? Yeah, they didn't in the medical field either. And so where we have this mindset that doctors, are making all this money and they're doing so great, they're really, really not. A lot of doctors are really struggling, and a lot of doctors don't even realize that there's a way out. That's where you come in, and that's where my ask for help comes in. Now, we've done something in our company that is completely revolutionary, and we have the ability to start the effect on change in the medical community. And now let me qualify that in this way. In order for you and I, regular Joes, to get better care, and I'm not talking about care that gives you a pill that masks a symptom and you're still not getting better. I'm talking about care that cures your ails. In order for you and I to get that kind of care, the medical system needs to go to a cash-based model and away from insurance. Because insurance is always going to dictate what doctors can do that will pad the insurance's bottom line, not take better care of you. And so it's incumbent upon us to look at, okay, well, how can we help doctors get there? Now, before I go too far, I know you're probably thinking, who the hell can afford that? Yeah, and for a lot of things, I'm not even gonna lie to you. This right now in the early days is going to be for the top 1, 2, 3% of the population who can afford it. But here's what I can tell you about the doctors that we've had a pleasure of helping over the last several years leave insurance and go into cash. Yes, they're providing services and the top 1% are paying premium prices, but it's allowed so many of them to take 1 day, 2 days a week and help the disadvantaged at either reduced or absolutely free. You see, it's allowed better care across the board. It's allowed better care across the board. This is what we've got to do to help ourselves and this society. Okay, so now you're thinking, okay, all right, I kind of hear that, but how do we actually help them? How do we actually help them? And before I get into what we've done and what we're doing to help doctors and where I need your help, let me also just stop. And for any medical professionals listening, let me apologize. I'm going to apologize for all of the marketers that you have run across in your career who have done nothing but attempt to take advantage of you. My industry has sucked for medical for a long time because we realized, so many of us, and it's really sad to say, we realized, so many of us, that doctors were raked over coals by the insurance companies, and they wanted to come out into cash-based services, which means they need to find their own patients now, and so they need marketing. And so what marketers did was, okay, we're gonna just take you and throw you in a dunk tank. And real talk, many of us took advantage of you, and I'm sorry for that. That has to change, and I'm putting a stake in the ground that we're changing that. We've been changing that, and we're gonna continue changing that, okay? And so here's what we've done. Doctors need help with their marketing. And so we've created a platform for medical professionals that acts as their chief marketing officer. You see, here's the big deal. It isn't that there isn't a gluttony of service providers out there. It's that doctors don't know who to choose. They don't know when they should choose. They don't know what they should choose. And they don't know why they should choose. And when they make a choice, they don't even know if it's working. They don't even know whether it's working or not, because again, marketers have been really, really, really bad. Really, really, really bad. Let me give you a brief aside on a story on that, about how bad we as marketers are. Many of you know I wrote a book, and we've been publicizing the book and so on and so forth. And a couple months ago, I decided, let me try Amazon ads. And so we hired an agency that was very well reviewed and respected to do Amazon ads for us, okay? For the book launch. Not for the book launch, for the book sales, excuse me. And so I know that Amazon has this metric called ACOS, and that's the key metric on whether your ads are doing well or not. And it needs to be between 20 and 30% in the book genre, okay? I know that. So we hire this agency. They say all the right things. I don't tell them who I am and what my background is. I don't tell them anything, okay? I don't know if they looked me up or not. I have no idea, but I didn't tell. I just told them I was a regular guy who wrote a book, right? They started running ads, and 2 weeks in, and I know ads take a while to get going. 2 weeks in, they send me a report, and they're glowing about how great their sales have been. And the report talks about how many units they sold. Doesn't cover how much ad spend there was, and it also doesn't cover that ACOS that's supposed to be between 20 and 30%. I knew was at 1,300%. Yeah, that's not good. You see, that's what marketers have done to doctors forever. We've put lipstick on a pig and said, look, it's so pretty, but it's still a freaking pig. And we don't tell the truth, and we lie, and we cover things up. And so we've built a platform with this CMO platform. We call it the Medical Marketing Roadmap, where we actually take all the blinders off, where we actually help doctors develop a true strategy that's tailored to their practice that they can execute. And then we put them on a plan. But get this, guys, they are executing a piece of their marketing strategy every single day. And the platform tells them and walks them through how to execute this piece of their marketing that they need to be doing right now based on the size of their practice. It walks them through it every single day. It tells them what the outcomes should be. It tells them what they should be measuring so that they have complete and utter transparency and understanding of what's going on. So here's my ask. I need to talk to more doctors. We need to get this in the hands of more doctors. And so I'm asking you, who are the doctors in your life? Maybe some that you've known professionally, maybe some that you've known personally. I'm looking for conversations with doctors. Now, you're gonna ask, what specialties are you looking for, Atiba? It's a great question. I'll tell you, we specialize in the regenerative medicine and longevity industry. However, I'm looking for conversations with general practitioners, chiropractors, any types of surgeons, podiatrists, okay? Podiatrists, and any other specialist. I'm looking to hear and talk to them about their stories, about what they're going through in the insurance world and how we could help them escape, and how our platform will be able to help them escape. So that's my ask of you. And real talk, real simple, I really just need you to do me a favor and hit reply on this email with this newsletter, or if you're on YouTube, drop a comment and we'll reach out to you. Listen, I want to have this conversation with you because I want to talk to more doctors. We need to help fix our healthcare system. If the last month has not proven anything, we can't wait for Washington to solve our problems. I don't care what side of the political lines you're on. Guess what? They're all taken care of. Guess what? They're all paid. They are going to be okay. We're the ones who get screwed, and so it's time that we take control. So hit reply. Let's have a conversation. Love to be introduced to any of the doctors in your life. Thanks, y'all. Appreciate you.